Good morning, guys. My name is Dr. Achievement, and today here I'm going to present to you the topic DOMS. DOMS, as the name have been said, it is an abbreviation. All right, it is an abbreviation DOMX, meaning delayed onset muscle soreness. Delayed onset muscle soreness. All right. So let me explain before we go into this slide. Most times we go to the gym, we go for workout. Alright, so after finishing our workouts, we go home and we'll just decide to take some rest and we'll feel some pains. Alright, so this pains is due to the activities we have done in gym, and this pain is known as DOM. So it does not mean that the pain is being there, those inflammation or healing and repair are there because of you're having some certain issues. It's because of your body is trying to build, like repair, and the muscle, the more the DOMS are there, the more strength the muscle will, the more growth it will be there. All right. And delayed onset muscle soreness, DOMS, like I've said, from it's muscle soreness from exhaustive or high intensity exercise, especially the first time performing a new exercise. All right, athletes giving their maxima, like, okay, 1 to 2 days after exercise, about 24 hours to 48 hours. Okay, when athletes give their maximum focus, like in performing this exercise, maximum intensity and the rest. Okay, so type 1 muscle strain. Okay, DON is considered a type 1 muscle strain. It's a localized to the involved muscle and will result in muscle stiffness plus tenderness. Okay, passive stretching will increase your symptoms, which is one of the reason why you feel DOMS, why you feel stiffness, or sorry. All right. Okay. In this part, this first slide is saying that the DOMS is like in a characterized manner. We are just to characterize this situation. Okay. 1 to 2 days, this issue is there. All right. So after the exercise, 1 to 2 days after the exercise, which is 24 to 48 hours. All right. So it is a type 1 muscle strain. All right, and it's localized to the involved muscle, the muscle you use basically in performing this exercise. Like if we say bicep strengthening, okay, like flexion of the elbow joint, all right, using the weight, then the muscle basically that is involved is the muscle basically that is involved is the biceps muscle. So if there is any pain regarding to this, then we'll say the patient is having DOMS. All right. So the part 2 is saying localized to the involved muscles and will result in muscle stiffness plus tenderness, and the other line is saying passive stretching will increase your symptoms, which is one of the reasons why you feel stiffness. So if you stretch, you feel some pains, and you feel stiffness. All right, that's why you don't feel like stretching. All right. So, major cause of eccentric contraction. Eccentric contraction, we know the kind of eccentric movements, like let's say for now you can see a picture on the slide where flexion is happening at the elbow joint. The biceps is getting stronger, and in the extending position is the eccentric contraction. Eccentric contraction recruits fewer motor units, and thus the force generated is distributed over a smaller cross-sectional areas of the muscle. So this decrease in tension per unit area cause greater injury to the tissue. So example, okay, level run pain, downhill run pain, not caused by increased blood lactate concentration. All right, okay. Now, biochemical markers such as creatinine kinases and lactate dehydrogenases are found in the blood of DOMS sufferers, which is consistent with muscle fiber disruption. All right. This line is just telling us that in case of the major causes of the DOM, let me start from the head. Major causes of the DOMS is eccentric contraction. Okay, the eccentric contraction recruits fewer muscles, so it does not cause much DOMS like the eccentric contraction. And level rumping, downhill rumping, not caused by blood, is not caused by DOMS, is caused by not caused by blood increased blood lactate concentration. Level rumping and downhill rumping. Okay, so in this DOMS issue, biochemical markers such as creatinine kinase and lactic dehydrogenase are found in the blood of DOMS sufferers, which is consistent with muscle fiber disruption. All right. So isometric contraction, muscle contraction, but does not shorten. Okay. The other part of where the picture was, we're just explaining the kind of contractions that are there. Then you can just see for yourself and read for yourself. All right. So we are moving next. DOMS and performance. DOMS can also result in a short-time loss of muscle strength. All right, a reduced joint range of motion and possibly swelling of the affected muscle group. All right, so DOMS decrease muscle force generation. Due to the pains in your muscle, the force generation will be decreased and can result in a short-time loss of muscle strength, of course, and the joint range, range of motion will be affected because you'll be feeling pain. You can't perform the range of motion. You'll be feeling some kind of swelling in that muscle area. Okay, loss of muscle strength from 3 factors. The loss of muscle strength is coming from 3 factors: physical disruption of muscles and failure in excitation, contraction, coupling appears to be most important. Loss of contractile protein. All right. So if you see a patient that is having DOMS, then the patient will be having loss of strength, and you can see the PPT. The PPT is saying that the loss of strength is coming from 3 factors. All right. I won't go deep in explaining much. All right. You can just read for yourself. We are moving to the muscle soreness, DOMS, and performance. Okay. Muscle damage, decreased glycogen resynthesis. Okay, slow or stop as muscle repair itself, limit fuel storage capacity of the muscle, and other long-time effects of DOMS, weakness and structural damage. All right, so these are the kind of damage we will see in a patient that is having DOMS. All right, then we'll just move further. Reducing DOMS. How to reduce DOMS in a physiotherapy intervention? What advice, like a sports therapy, which I am, you ask yourself, okay, now my patient is having DOMS. What am I thinking of doing to help my patient get better? And the patient should not have these DOMS. So how can I reduce these DOMS? Because we can't stop the training. The patient is training basically because of some tournaments. So we have to use a strategical way to reduce DOMS. All right, so now must reduce DOMS for effective training. How? DOMS should be treated initially with active rest and anti-inflammatory measures such as ice. All right, it has also been researched on back muscles DOMS with a positive pain reduction. All right, ice, anti-inflammatory, heat in back muscles most times. All right. NSAID, we are talking about the some like of anti-inflammatory, all right, non-steroid anti-inflammatory drugs. Okay, may be used for pain relief, but long time use may impair satellite cell healing in DOMS. Okay, so this is a gentle massage and pressure garments have been shown in a researcher's study to provide a reduction in the duration and severity of DOMS. However, deep tissue massage should be avoided during the first 24 hours. All right, so exercise muscle strengthening in this early stage phase should also be avoided. So exercise should be avoided, muscle, especially muscle stretching. All right, but we can't stop our training for our patients. So strategies to reduce DOMS in a more nicer way. Strategy to reduce DOMS. Okay, minimize eccentric work in early exercise or training. Okay, start with low intensity and gradually increase. All right, so you can see in the picture which I've showed in this slide, the weight is starting from small to large. All right, so now the take home from this message, this brief topic I just wanted to share today: DOMS. Relieving DOMS progress slowly. Okay, sleep is very important. Sleep helps to reduce DOMS, and rest helps to reduce DOMS. All right, rest and sleep, they are of two different things, but the major point, what they have in common is that rest is in both sides. All right, you're resting when you're sleeping as well. All right, so thank you very much, guys. Thank you for coming to watch this video, and have a nice day.